Thank you for that introduction. I guess I'm going to leave now before I change anybody's mind. It was nice seeing you again. No. But Paola called and asked me several months ago to put together a little talk. And her topic that she was interested in is how your mouth can impact your oral health. And I'll admit, this is not a topic that it's a topic I know a lot about, but it's not a topic I traditionally speak about. So, you know, I just put together things in a fashion or an order that makes sense to me. And I do have some references. If you are inclined, you can find a lot of information online. Of course, you know, some of what you find online is very good. And some of it you have to take with a grain of salt or have a few different options. Like everything, we need to read pros and cons and come up with our own opinion, our own decision about life and our own health especially. And so what I'm going to talk to you a little bit about today, or the main question, again, as she asked me to address, is can your mouth impact your oral health? So I gave you the answer, so now you also can go home. Of course, yes, your mouth can impact your overall health. The main thing that impacts our overall health, if you read any or hear any medical professional talk to you, is going to be dietary intake. You know, our society especially, we're very, very fortunate where we live and in the time that we were born that we have access to good food sources, and we have a tendency as Americans to overindulge occasionally. That's why I'm wearing such a flowy little dress here today. And that overindulgence does lead to, you know, especially the foods that I love that were my comfort foods are not always the healthiest. So it leads to other systemic diseases such as diabetes and obesity, cardiovascular disease, and a lot of those other types of diseases can be impacted by what we put into our mouth. But we need something to chew that food up. And so our oral environment, this is the gateway of everything getting to the rest of your system. And this gateway has some protectors. And my little cartoon here is going to show you, you know, some of the soft tissues and the hard tissues. The soft tissues sort of focus the food where it needs to go. And then the food is masticated or chewed up and ground up for your body's utilization by your teeth. And in that milieu of things that are in our mouth, we also have a whole population of bacteria. And those bacteria are really good for us because they do help us digest our food. And those bacteria can overtake some of our systemic immune systems, and unfortunately then is when we have problems, like balancing the bacteria. And we've been trying for hundreds of years to try to figure out what the right approach is. I think it was 1891 when the first association was made between oral organisms and how they might potentially impact your overall health and travel through your bloodstream and get to different organs. This was popularized in theory in the 1930s with a theory called the focal infection theory. And a lot of people lost teeth, you know, if you have elderly parents like I do, you know, that may have been born sometime in the 30s. They lost teeth because they thought bad teeth would impact their joints. And a lot of research has been done since 1891 to today, and we can't really scientifically prove that a bad tooth will cause every typical human to lose a joint or to lose some other organ system. When I say typical human, I'm talking about people who have basically healthy immune systems. You know, there are always going to be exceptions in medicine, and I have to emphasize this to my patients all the time, is we base all of our decisions when we're in medical professionals on what happens in that bulk of the population. So 80 to 90% of the people will behave a certain way, but we have outliers that always heal better or never heal at all, no matter what we do, even if it's done right. So our bacteria, I just want you, when we're making discussions about what kind of bacteria are good for you, what kind of bacteria are bad for you, you have to realize that every human has a unique group of bacteria in their own mouth. And people will constantly say to me, oh, you know, I have bad teeth. My parents had bad teeth, so they gave me bad teeth. And it's not necessarily they gave you bad teeth, but bacterial populations tend to be the same within a same living unit. So bacteria in your mouth are given to you, your progression through the birth canal. And then after you progress through the birth canal, you get organisms in your mouth from your mother or father tasting the food and making sure it's not too hot and then sticking the spoon in your mouth. You know, and so then we build up colonies of bacteria in our mouth that help each other out. So there are some bacteria, like the gram-positive organisms, that produce food sources for other bacteria, the gram-negative organisms, that all live in our mouth in some happy community, and as long as they're in balance, they help us. It's when the balance is disrupted that it becomes a problem. And so we're going to talk about some of the disruptions. And before you leave today, I do have another little sample that was provided to me. There is a company that makes dry bacteria pills, probiotics, basically for your mouth and gums. And they have provided me with a box of samples. So if everybody wants to try one and see what they taste like, I have kids' versions as well as the adult version. But feel free before you leave to grab some or one or however many. She thought there'd be about 30 people, and so I brought stuff for about 30 people. So that's the one thing I do want everybody to leave with, a toothbrush and a little bit of a oral bacteria booster. So that usually the colony of bacteria in your mouth is set, but if you take medications like antibiotics, then it's going to impact all bacteria in your body. And so if you get sick at any time in your life, you know, your bacterial colonies get kind of out of whack. And then sometimes those bacterial colonies, the bad ones will super grow over top of the good ones. So all foods like eating yogurt a day is very good for your teeth and your oral environment because it provides you with healthy GI and oral bacteria to repopulate your gut and your mouth with things that you should have. Now, you know, not everybody can tolerate milk products, you know, not the fat that's in some yogurts. So, you know, again, we go back to there's always a balance, you know, a plus and a minus to every recommendation, to every decision that we make about health in our body. But this is just a dry, so you don't have the fat or the sugar or whatever other components that could be harmful. It just helps you get the bacteria. But you don't have to have a product like that. You can eat yogurt or drink kefir or any other live bacterial culture. You can buy dry bacteria pills in all kinds of forms. Like if you have a medical procedure, you know, where you have to wipe out all your bacteria, then they'll tell you to take Fluorastor or Align, two other products that are sold to do the same thing. But so, and then the last caveat that always impacts whether or not those bugs can get into our system is inflammation and our vascularity. You know, an irritant has to break through the lining, the protective mucosal lining, so something happens where that lining gets disrupted, and then oral bacteria can get into the body, and our immune system, through the natural vasculature, we have white blood cells, will leave the blood vessels, kill those bugs, and this is constantly going on in our mouth and other parts of our body. We don't even know it because we're programmed to take care of it. It's when this balance, just like the bacterial colonies I talked about balance, when this balance of, you know, control of the bacteria gets disrupted and our body can't handle it, that's when issues are going to happen. And I use the analogy that we're all familiar with recently as COVID. You know, the virus itself was bad, but the people who died from COVID died because their body had a hyper-exaggerated immune system and it produced a lot of fluid, and then they couldn't breathe. You know, so it was the body's reaction to the virus that actually was hospitalizing and killing people, not the virus. So our immune system has to be in balance or it can be harmful. And there are other systemic diseases you're probably familiar with. Rheumatoid arthritis is another one. You know, there are a variety of GI, and I'm sure you had a GI lecture, I understand, in your last series. You know, and a lot of IBS is also different bacteria and disruptions in bacteria have been tied together. You know, so there are a lot of situations like that where you disrupt the body's immune system or the body's ability and your own natural colonization for health, and you throw the balance in the favor of disease. So we're constantly, as medical professionals, trying to keep the balance in the favor of health as opposed to the balance of disease. If you want to know kind of a little bit about me, I know Jim did a beautiful job of talking about the confidence of people in the community. I've been very blessed for the 23 years that I've been in practice here in Elgin, that I've had a lot of people put their trust or confidence in me, whether it be patients or other practitioners. I'm a dental specialist. I graduated as a dentist from the University of Iowa, and then after that I loved teaching, and I knew to teach I had to specialize in an aspect of dentistry. So I went to Northwestern, where I got my master's in science as well as my certificate in endodontics. Now, there are 9 dental specialties approved by the American Dental Association. Endodontics happens to be one of them. Endodontics is the study of the inside of the tooth and how it impacts your body, where other aspects like periodontics is the outside of your tooth. Orthodontics would be moving those darn teeth around so that we can function a little bit better. And prosthodontics would be when you've lost the function of those teeth, recreating the appropriate shape and strength of a tooth so that you can actually function again. So to do any of the specialties that are approved by the American Dental Association, you have to go back to school for 2 to 3 years. So at that time, a million years ago, it was 2 years for me, and so I went to Northwestern for 2 years. When you're a specialist in dentistry, you do not have to be board certified, which is different from medicine. To get hospital privileges, you have to be board certified. But some people choose to be board certified, and to be board certified, you have to take an oral exam, a written exam, and you have to present cases that you've treated to a peer body of your peers. And then you have to pass all those particular sections, and then they grant you the title of board certified. And there's a panel of peers. So I was fortunate in teaching. You have to be board certified in order to do the jobs that I did. And I was the director of the grad program of endodontics at the University of Maryland. And to do that, I had to be board certified. So I forced myself through that particular process. Then I did teach for a period of time. Like I said, my first role was I was the graduate program director of undergraduate dental training at the University of Maryland. That means people who are becoming dentists. And after that, then I took over the role of the graduate program training, which are the people who are already dentists like me, want to become endodontists. And after that, children change your life. And then I decided I wanted my children closer to their grandparents. And Keith and I moved back from Maryland here to Illinois, where his family has been in Elgin from the turn of the century. And yeah, forever. I think his great-grandfather started several businesses, and they had many businesses through the years, and they've been very involved. They have a very civic responsibility attitude, and they've been very involved in politics. And it's, people will constantly come, all of them, his mother, his father, his brother, his sisters, and they'll come to me at the office and say, I voted for you for city council. And I'll say, probably not. It's the wrong C. Rauschenberger. My sister-in-law, Carol, happens to be on city council here in Elgin for the last several years. And they'll say, I know your mother. I say, I don't think so. I'm a Rauschenberger by choice, I always tell people. Kind of a traditional girl. But anyway, so that's my background. When we came back here then, I worked for a group practice of endodontists in Oak Brook and Naperville for 3 years. And then I bought my own equipment and took over a practice here on Dundee Avenue in Elgin. So that's where I've been since '99 and where I've had the great honor to serve a few faces that are familiar to me. I am really moved by this topic because and I'll get into the actual presentation now instead of just the introduction. of personal reasons. I said I wanted to get my daughter closer to her grandmother and grandfather and all of her cousins because I lost 3 pregnancies. When I went into labor, I went into labor, I should say, at 25 weeks with my daughter, who is now 30. And at that time, they weren't really sure if they can, I was full-blown labor, and they weren't really sure they can control the labor, and she was predicted to be a pound at that time, you know, and they kept me in the hospital on drugs and did everything they could to control the labor. This whole entity is called preterm labor. And so preterm labor is one of the systemic classifications for impact from the oral environment. And at that time, lots of studies were being done about periodontal disease and issues in your gums and the bacteria in your mouth and how they could get through your oral environment to the placenta and then cause disruptions in the placenta and stimulate, you know, preterm labor. So, you know, it was very near and dear to me. I did a lot of research at the time. I must say that there are associations that women who have preterm labor, they're huge in that big bell curve, huge percentages of them that do have periodontal disease. I happen not to be one of those, you know, so still haven't, you know, it's not causative. They haven't found the actual organism. They still don't have the answer 30 years later to preterm labor, even though there are lots of grants and lots of study, we're still working on it. But I have to say that's why this topic is near and dear to my heart. You know, so
Casey is just fine.
Casey is fine. Yes, she is. I was fortunate enough, they kept me 5 weeks on my back in the hospital, and I wrote a grant because I was teaching. They brought me my computer, and I just did it like this. And it kept me busy writing the grant. My husband was there every night. And if anybody knows downtown Baltimore at that time, 30 years ago, Jim, you know, 1 block over, you know, very treacherous, you know, especially at night, you know, a lot of gang activity right around the campus. You're fine on the campus, you know, but so my husband was dedicated enough that he came every night and went home at dark and kept his little path that he always stuck to be there for Casey and I. But yeah, she was then born 5 weeks early and had a little issue because she was a preemie, but worked through that, and now she has her own business and lives in New York. Yeah, so we'll talk about oral health just in general. You have the hard tissues and soft tissues, and then what we've already discussed a lot about is the biogenome, where we've already talked about how it's established and what we can do if we take antibiotics, how we need to do probiotics to try to repopulate and replenish those with good bacteria so that the bad bacteria don't take over. If you have to be on certain types of medications, also a good, other than antibiotics, cancer therapy. So, and I always talk to my patients, so if you've been a patient, bear with me. But there's a little tiny hole here at the tip of the root, and that's where all the blood vessels and innervation come to the center tissue. There's a bunch of nerve tissue that come to the ligament that holds the tooth into the socket. And then this tissue inside your tooth is not really a nerve. It's a collection of connective tissue that has nerves in it, but blood vessels and a lot of other tissues in the center. And so the tooth is a hard structure, kind of like bone marrow inside a bone. And if in that hard structure, this tissue can take some injuries up to a certain set known number of times. I shouldn't say unknown number of times, because to each human, it's unique. Could be 5 for me, but 10 for you. So in dentistry, when you have an insult or an injury to the tooth, whether you break the tooth, you get a cavity, you get a crack, whatever the injury is, you get in a car accident, there's a certain number of times that tissue in the middle of your tooth will be able to heal itself. Eventually it can't, and that balance gets thrown off. And then that tissue becomes what we call necrotic or dead. Just like meat left in the fridge too long, then dead tissue decomposes. And then decomposing tissue will leak back out the tooth and into the bone. Your immune system is programmed, like we showed in that first slide, with the inflammation to allow some white blood cells to get out of the bloodstream. And then those blood cells will basically clean up the junk that's leaking out of the bottom of your tooth. And in this process of cleaning up the junk, it also softens the bone that holds your tooth in the mouth. It's the body's programmed way to get rid of a bad tooth. So if you did nothing, it just keeps softening the bone till the tooth gets loose and drops out of your mouth. Soft bone is a good food source for oral bacteria. So if oral bacteria get through the skin, like we talked about before, and into this area where all this activity is happening, that's where it can overcome that balance, and you'll end up swollen out to here like overnight, or you could be in the hospital. If the bacteria, the head is very dangerous, and in fact, back in 1891, when they were studying different things about the biology and the immune system, they found that there were no valves in the veins in the head. So if bacteria got into your bloodstream and you didn't kill the bacteria, they went straight to your brain and caused an abscess. So having teeth that are dead and deteriorating the jaw bone, usually the body can keep that process that I described in check. But if it becomes systemic, where your body, you're starting to run a fever, getting tender glands, or it's causing the tissues to distend because of the inflammatory process of all those cells getting out there to try to kill something, that's where you need to seek help. Because without an antibiotic, which is wonderful that we have antibiotics that kill bacteria, those bacteria are going to go to your brain. So that's why it's really important to understand sort of the anatomy of the oral health when it's healthy, or what it looks like when it's healthy, so you can understand when people are talking to you about disease, what that means. And there are different kinds of dental disease. I already talked to you and described this one. This is the endodontic component, where the cavity touches the tissue dies, leaks junk out, and the bone softens around the bottom of the tooth root. It can also just break through the hard tissue, and that's the classic cavity. And if the sooner you remove those bacteria, the less likely they're going to progress to this stage. But when you remove them, it can't just leave the tissue open. So we're always putting a restoration of some sort, like you were talking about, your dentist is suggesting some special restoration material. And they keep doing research on what's the best restoration material. Because the problem is, it's now you have a tooth structure here, and you've removed the junk that's going to cause you problems if you don't remove it. And then we put something there to build it back up. There's an interface between the tooth and the material. I don't care if it's a beautiful bonded filling or if it's a crown or what that is, you have an interface. And where that interface is, you're going to drink coffee in one meal and then follow it up with ice cream. So you have these huge swings in temperature constantly going on. And then the jaw itself, when it's chewing, that's 200 pounds per square inch. So with those kinds of pressures and that kind of swing in temperature, those interfaces eventually open up. And when they do, bacteria get into the interface because they're tiny, just like termites. They get in and get under and cause a problem. So people always say, well, why did my filling go bad? Why did my crown go bad? Why did my root canal go bad? Or why do I have to have another root canal? Which, if you have a tooth with a root canal and then it has a crown, and you get over many years this little opening up, just like a sidewalk that's cracking in the Midwest, and junk is getting in there, root canal teeth don't have any sensations on the inside, so you don't feel it, you don't know that anything's happening, and all of a sudden those bacteria start to touch materials that we put on the inside here. And I'll talk about that in a minute, what that whole process is. But when they touch the material and get it dirty, it's just like dishes. It's made out of plastic. If you eat off dishes, same food juice, same oral bacteria. Would you think of continuing to eat off that dish without washing it? No, because you'll get sick. Maybe once or twice, but you wouldn't continue to do it for a month, or let alone a few years. So if bacteria break their way here and you restore it, understand that you got to keep it clean, you got to keep the bacteria off, but over many, many years, gaps are going to open up and you may have to start the process all over again. We're living really long lives in the United States. We're lucky to be here, but that means our life expectancy with the healthcare we have, whether you like it or not, the kind of healthcare we have, but with the advances in medicine that we have, we can live to the late 80s, early 90s by actuarial table, and I'm married to a financial planner who does retirement planning. So I know he's constantly looking at new research on that topic. So we're going to have our teeth a long time. I'm just telling you, don't be surprised if you're doing your best to keep it clean. If you do nothing, that's going to happen a lot faster. That I'm talking. It won't take a few years. It'll maybe take a few months if you just let the bacteria stay there and don't clean them off. But even with cleaning them off, understand that someday it might have to be cleaned off again, because it will wear out because of the environment that we have inside our mouth. So we've talked about endodontic disease, we've talked about caries. Gum disease is the other thing that happens. Now, the other thing that we know or have known for a really long time about bacterial colonies in our mouth, not only are there a bunch of them, and some are predominant and they run in families to what kinds are in your mouth, people who have a lot of cavities are just blessed with the kind of bacteria that produce acid. And that acid then attacks their teeth. And that's why they have cavities. If you don't have the kind of bacteria that produces cavities, you think, I'm really special. Because, I never, have any problems. I don't know why you have so many problems. But the predominant kind of bacteria in those people's mouths typically are the kind that cause gum disease. So the kind that cause gum disease and the kind, if you have a large balance of those, instead of getting cavities, you're going to get inflammation into this tissue where the gum attaches to the root on the outside. And then when you have inflammatory problems here, that's where this inflammation also has been more tied with those systemic issues that I referred to earlier, like my experience with preterm labor or some other experiences with irritable bowel disease or even some cancers. They're tying relationships between oral inflammation and the bacteria from gum disease to different organ systems, like the H. pylori, for instance, is an organism that's found in the stomach. A lot of stomach cancers, you can colonize high counts of H. pylori. H. pylori is a periodontal pathogen. So lots of research being done right now. Our government is funding lots of things to try to find answers and try to help people. But that's how this can impact us all systemically. So the spread of infection, as I said before, our body usually can contain it. Infection is not discriminatory. It's not age dependent. It's not race dependent. It's not assigned at birth gender dependent. It happens to everybody. So it can happen when it breaks through the system, either externally, as you can see in this very young man, or it can happen in the mouth internally. So depending on where it's happening, depends on what we do for treatment. So externally, you have to have an antibiotic. Because to get external like this, it's now invading, other systems and passing through, and the thing that we used to worry about in 1891. Here, the body is containing that. Our white blood cells are stretching the tissue, but when it's inside the mouth, you can drain or lance or however you want to define that topic, and release some of the pressure and get rid of those old blood cells, kind of like popping a pimple, and you don't always have to have antibiotics for this problem, because you don't, and again, why would you not take antibiotics? Because of what I already told you about. Antibiotics are good when we need them. They're bad at messing up that balance, and every time you take a drug, you're one step closer to an allergy with that drug. Multiple exposures lead into allergies and some sort of resistance. The bugs are smart. Once you're exposed to it, they'll remodel themselves and pass that information on to all the other bugs in your mouth, and all of a sudden that bug no longer is killed by that antibiotic. And so you get into the hospital, and a lot of the super infections in hospitals are by overuse of some of the common antibiotics, because in dentistry or maybe for a child's ear infection, we didn't realize that, the damage, that it wasn't all good, that there was a little bit to be cautious about. So I'm just saying, depending on the issue and how it spreads depends on the treatment, but so many times people will come in, they tell me my tooth's infected, why didn't you give me an antibiotic? And I'm going to tell you, because it's not really in your best interest at this moment. But so we've talked about all of these things, the causes of inflammation and bacteria and the hard tissue changes that can occur and how bacteria spread. But I just want to draw your attention. This is a little slice of a tooth in 3D. And So in 3D, we get to see things we couldn't see before. Medicine it's marvelous how it always changes. But always the x-rays, and I'm going to show you a couple x-rays. You've seen your own, but I'm going to show you some x-rays here in a minute. But there's a layer of bone by your cheek, and there's a layer of bone by your tongue, and your roots of your teeth are buried in the middle, in the softer bone that's in the center. So they're like 3 layers of bone. When you look at a picture, any picture, whether it's that couple over there on the wall, you see what's in front, on the front of the picture. You can't see the back. Here in a flat x-ray, it's like holding 4 fingers up in front of your nose. You see the front one, you see the back one because it's longer, but you can't see the 2 behind it. And that's because everything is superimposed over everything else. So we were limited in treatment for many years because x-rays were flat, just like photographs. But now we can look at things in 3D. And I don't know if you can see, but this white scoopy thing, that's that outer bone I was talking about. This is the bone by the cheek right here, this white little band. And this is the bone up by the tongue back here. Here's a tooth that happens to be a molar. I'm just going to tell you that because it's got multiple. Here's that pulp I was telling you about before. And the dark space on the center here, so things on an x-ray, no matter what kind, a 3D or a flat, that are solid are white. And on x-rays, things that are not solid, they're going to be black. Everything else is some shade of gray. So this is the cavity. When the bacteria touch this tissue, they cause it to die. Junk leaks down through the tooth into the bone. This is the bone, the black around here, that's softening up, trying to loosen that tooth so it will fall out. And it not only softens here, but it softens a hole right here in that big, thick layer of bone. So when it's softening a hole there, junk is going to be leaking out under the tongue and making it hard for someone to swallow because your tongue is going up. So I'm just telling you the progression or spread of bacteria and how you can see it. And the impacting factors for caries, obviously, are diet and anatomical form. So when you're getting cavities, it's because you have grooves and fissures, you have the right kind of bacteria, and our food that we eat is contributing to them producing acid. So sticky foods, things that are high in, carbohydrate intake, beverages, if we love to have a soda, carbonated beverages happen to demineralize the out surface of the enamel. And then the sugar, if you're having sugar in the carbonated beverage, but if you're having diet, you're just making holes in the outside of the enamel without letting the bacteria get in at that time from that substance. Sipping a soda all day, there's a huge campaign for years in oral health that if you sip a soda, every time you sip it, you get 20 minutes of acid attack on your teeth. So if you want soda, have a soda, but don't drink it all day long, one soda. Take it and drink it like drink a quarter, drink a quarter, drink a quarter, so that you're minimizing the number of times that acid is attacking that outside surface. The other thing happens with pregnant women. They say, oh, for every child, I lost a tooth. Well, it's not the child robbing any calcium. Your calcium that's incorporated into your enamel is there and it never leaves. It doesn't wash out unless you do something like drink a soda, to get it out of there. What happens though, pregnant women, because they're nauseous, snack. And every time you take a little snack, you get an acid attack, just like sipping a soda. So pregnant women have a tendency to get more cavities during pregnancy because they're getting more acid exposure on their enamel than they would at any other time in their life. College kids, also, same phenomena. They go from being home where they're having 3 meals a day to now they're in college where they eat wherever they want, whenever they want, and they're snacking more or snacking when they're studying. And so then they come home at break and now they need a root canal because they, aren't used to controlling things on the outside or their diet. But saliva also, medications can impact saliva. Saliva is a natural thing that flows over our teeth, helps us clean our teeth without even brushing them. So if you do anything to your saliva, because you have to take a drug that changes your saliva, you might want to add some sort of an oral irrigant or artificial saliva, or rinse your mouth frequently with water because you want to get the bacteria off that surface where that acid can be harmful. fluoridated water, we can have a whole conversation for a whole evening on the pros and cons of having fluoride in the water. The reason fluoride was put in the water is because there's a lot of information out there that demonstrates that, I told you every time you drink a soda, there's a little loss of the enamel surface because it demineralizes. If you have fluoride in the water and you drink a sip of water, now that fluoride incorporates into that enamel that was demineralized and it strengthens it. So there's this constant demineralization, remineralization happening in our mouth all the time. So if you start filtering your water or drinking a lot of bottled water that's filtered, you're not going to get the benefit of that additional fluoride constantly bathing your enamel. So for people like young kids who are doing a lot of sports that start to get cavities, it's because it's convenient to carry bottled filtered water everywhere. If you live in a community where you're worried about well water having awful things in it and you drink a lot of filtered water, or like my neighborhood where now lead is a big concern because I live in a 100-year-old house, you drink a lot of filtered water. How do you get around that? You need to add fluoride somewhere. So I would suggest you go and buy whatever product on the market at Walmart that has fluoride in the rinse, a mouth rinse. So after you brush your teeth, you use a little fluoride rinse. ACT is one of them, ACT. There are several brands. I'm not in favor of any brand over another. As long as if you have filtered water and you're not getting the fluoride on the surface, you might want to add some fluoride in some other route, is what I'm saying. Whatever brand you buy, though, pay attention to what the bottle says, because it'll say rinse for 30 seconds, or it'll say rinse for 60 seconds. Do you know how long 30 seconds is when you put it in your mouth? Usually we put it in, go swish, swish, spit. Yeah. So I tell people if they're going to use fluoride, put it in the shower. And as soon as you get in the shower, take a swig. Keep it in your mouth for as long as it takes you to get the soap in and out of your hair. And then spit it out. But so some way to keep it on the surface and to keep it on the surface long enough. Otherwise, we're just fooling ourselves into thinking we're helping ourselves. So they do, but sometimes you need more than what the toothpaste has. Okay. And again, appropriate oral hygiene, and why I have my favorite thing that's coming up here in a little bit. I'll try to speed this up for you. But a lot of like mechanical toothbrushes are going to tell you to brush your teeth for 2 minutes. Again, that's an eternity. And you feel like, with little kids, we take an egg timer and you turn it over and keep brushing till the sand runs out, but in an adult, you're busy. You're thinking of everything. So the contact of the fluoride in the toothpaste on your teeth typically, and most adults brushing their teeth is not long enough to provide the benefit. And a lot of people don't brush their teeth in the shower for the full 2 minutes that they have the soap in their hair.
How about if you use the electric toothbrush and you use it to run other things that not for only till it buzzes you?
Yeah, if you have an electric toothbrush that has a timer and it buzzes at 2 minutes.
Yeah, mine keeps going until it's,
Well, that's why they have timers, and that's why they have buzzes, and that's why, because we've found that you need to brush your teeth for a full 2 minutes, to get improvement in the oral hygiene. Both to get the bacteria off the surface, get the fluoride on the surface from the toothpaste, and to eliminate the periodontal issues. Okay? Again, we went through this about what happens in endodontic disease. So, it goes from this situation where the bone is nice and healthy to this situation where the bone is not, and then it gets infected. So what does that look like in 3D? So in 3D, this is looking at your teeth from the top of your head straight down. This is your cheek where that bone is, and here's the bone by your tongue. And you can see all the bone around here is missing around that particular tooth. And it's starting to break a hole through the outer bone like we talked about before. When we look at this window, you can see this green line right here. So this window is a representation of, if you extended the green line straight through the jaw like that, what we're seeing is that 175 micron slice of the jaw right here in that particular window along that line. So with the technology, if I move the line on the computer toward your cheek, this window moves. You know, if I move it toward the tongue, it moves again. So we get to see what things look like in the jaw. Now, this little tube that you see right here is the tube that all the blood vessels and nerves come into the lower jaw. If you get an infection this big or where the bone is deteriorating, it also wears away and puts pressure on all those nerves and blood vessels that feed your whole head right down here. So it's just demonstrating again how things can spread systemically from an oral issue. And people will come in when this much bone is destroyed and their face feels numb. Kind of like if you lean on your arm or your leg and we say it goes to sleep or whatever. It's the pressure of the infection pushing on all those nerves. And that's how it spreads. So endodontic treatment, obviously, when we know that's going on, if we remove that tissue, disinfect it, and then we put a filling in there like I told you about before that's made out of plastic. The reason it's plastic is because you can custom fit it to the same unique shape of everybody's tooth, because everybody's tooth is like we're all humans in different shapes. Our teeth are inside are different shapes. So we condense this plastic into a custom fit, and it's sterile when we put it in. There's nothing sacred about it, as I pointed out before. It's just holding space. It's medical grade caulk. You know, it prevents blood from out here from getting sucked back up inside, because if the blood got sucked into that tube, it would deteriorate and cause a new problem. And as long as people always say, how long does a root canal last? I said, as long as you can keep it clean. You know, so as long as you can keep the bacteria from getting on the plastic, it'll work. And I've got root canals in my mouth that are 30 years old. This is what a root canal looks like on x-ray. You know, after you clean it out, you put some pieces of plastic down in that space. When you're done, you fill in all the plastic, and then a filling gets put in the hole. This particular situation, you had to make a hole in a crown in order to do the treatment, and when we're done, we put a filling right in the hole of the crown. What do we expect when we're done? Here you can see there's some darkness of the jaw bone around here. If after treatment's done 6 months or more, this happens to be actually 10 years later, you can see that the bone comes back and it's natural around the outside. So if we can, people are always saying, oh, but there's still bacteria there. There's bacteria in our whole body. You know, if you can throw the balance of healing in favor of the body, your body's happy and you'll heal and you'll function. And so normal healing is going to look like that. How often does that happen? Go from like a deterioration to solid bone? In the human, 98 out of 100 times. It's a very, very predictable treatment, you know, and so in healthy people, there are always extremes on one end or the other, don't get me wrong, but in healthy people overall, it should work. As long as it can stay clean and as long as all the bacteria got out, as long as all the junk got out. You know, and it's the practitioner's obligation to get all the junk out and get all the bacteria out for you, the first ones that are there. It's your obligation to keep them out. So you're going to have healing, in a few cases non-healing, and then, as we talked about before, you have to maintain that healed state by continuing to brush and floss and get regular visits. What else can happen from a problem where it spreads? I already showed you how it spreads out the jawbone, but if this problem, and here's the 3D scan, this is your maxillary sinus. So if it's an upper tooth and it's creating all this deterioration in the jawbone, it also creates a hole in the floor of the sinus, and then junk from your tooth now is being dumped up into your sinus. And right here, this gray band, that's your sinus lining. So when you get a sinusitis, it's because this air cavity up here gets filled in with tissue. This gray stuff is tissue. It gets filled in with tissue when it gets irritated, either an allergen or a bacteria or a virus. And here just shows the tooth dumping stuff to irritate the sinus. The good news is if we get all the junk out of here and this heals, the sinus will also heal, and the lining of the sinus will also come back to a normal dimension. So what questions are remaining? We're getting here at the end. You know, all through science, there's been increasing evidence that it supports that all the things that I've been talking about, like microorganisms and how they can impact our health disease. And we're going to come out with suggestions like I have in the mouth, you know, on how you minimize that and how we keep a healthy balance. But things that have been shown so far, there's been issues with Alzheimer's disease, issues with stroke, issues with cardiovascular disease and heart valves, issues with, as I already described, preterm labor, all stemming from periodontal organisms in our mouth. So these local factors we have control over. The way we bite, if we're biting inappropriately on things that have been made in our mouth, if we have bad habits like sipping on a soda, or if some people in life also, in order to heal because of a large stress or depression, turn to alcohol. People with alcohol, also, you know, a large intake of alcohol over a long period of time can alter their oral flora because alcohol kills bacteria for us on our hands, just like it wipes out your normal colonies in your mouth if you're excessively drinking. So there are some things we control, and some of the other, smoking is another thing. It impacts our vasculature. And so people who smoke have a tendency to have less ability to heal. It's not that you can't heal, it's just your healing capacity is altered. So is it, you know, we all have our vices, but I'm just trying to tell you, if you want an implant, it's been shown that implants don't take as well in people who are smokers. You know, so you have to do more work or have more things happen in order to get your implant to appropriately integrate. Same thing with healing of natural teeth. It's slower on a smoker, slower when there's higher alcohol intake. And the other thing is diabetes. You know, the diabetes impairs the vasculature in a way that you will heal, but it's slower to heal. And sometimes if you're diabetic, you will need antibiotics for things. I told you the healthy person issues with antibiotics, but in diabetic patients, we over-prescribe antibiotics. And the risk, remember the risk-balance ratio we were talking about, your risk of getting a significant infection when you can't help yourself heal when you're diabetic, you know, or have a harder time helping yourself heal as a diabetic, will give your body assistance, will give you more drugs to help you acutely during a short period of time to heal. This is a great article that was just published in 2022. So it's one of the most recent articles. So if you have, and it's a nice little review that talks about a lot of things I talked about. So if you want to go into bigger depth or on this topic, it's easy to read. You don't have to be a scientist to actually read it. And it was published in March of 22. So, and it's published by a fairly reputable organization, the International Journal of Oral Science. So I'm sure there are several reviews out there. You can go from, you know, I pulled out some other reviews from 2017 to date. But this is the most current one that I saw that's hit the journal. And what you have to realize in medical literature is that it's in publication, or it's submitted for publication probably a year before it's actually published. You know, so that would be if you want more information on your own. And how can you alter the impact? We've already discussed several of those. You can try taking probiotics just in case you get into a situation where, you know, it just helps you keep the balance. It's like vitamins. You know, a daily vitamin, your body's going to excrete or not use what it doesn't need. But if you're in a situation where you need them, taking a probiotic in some capacity will help you. And if you guys, this is my 30-year-old premature baby. If you haven't, what a smile, yes. Yeah, really. We paid a lot for that smile. So in summary, you know, a healthy diet, healthy lifestyle, healthy biome, good oral hygiene control, you know, brushing and routine medical and dental exams so that if you have a systemic problem, you can complement it with the things that you need, and dentally so you get early intervention. The earlier you fix a problem like those early cavities, the less treatment you're going to need down the road. Unfortunately, pain does not always equate in the mouth to health. You know, it does in a lot of other situations, but those big areas of bone destruction I was telling you about can be picked up on some dental exams, And I can't tell you how many people come to me and say, well, I didn't do anything about it because it really didn't hurt. You know, it's kind of like high blood pressure. It's really not a problem. You can't feel it until you have a stroke. You know, so, you know, if you have a situation, they tell you that the bone is deteriorating around your tooth, I'm not saying you have to be there tomorrow. We really don't know when it's going to develop a problem. It could be tomorrow. It could be a year. But it will. It always, always does. And if you let it grow long enough, you'll end up in situations like we pointed out today where you're eroding holes into your sinus or out into the soft tissue where the organisms can get systemically. So early intervention is really key. Are there any questions for me? Yep. Yeah, Ronan, you had rolling.
It sounds to me like you hear about these dental implants that will replace all your teeth. You take care of a lot of problems, sir. Is that right?
When your knee hurts, do you cut off the rest of your leg? I'm going to throw this out. A dental implant is a great replacement when you cannot keep your tooth. That is correct. So if you break the outside of your tooth, you crack the root out on the outside surface, there's nothing we can do to help you keep that. But a dental implant is made out of titanium, just like a hip replacement or a knee replacement. And we used to think, oh yeah, get a bad tooth out, just stick an implant in there, it's going to be great forever. But people get periodontal disease around implants. If you have the right kind of bacteria, it'll destroy bone around an implant, around a natural tooth. You know, so it's not a panacea for replacing a healthy tooth. You know, it's only there, and the technology is fantastic, like hip replacements are, or knee replacements. You know, I didn't make light of that. But, you know, it's like once you have it done, it has a lifetime also, you know, and so the science for it keeps advancing. You know, like the hip replacements today are better than they were 5 years ago. The implants in the mouth today are better than they were 5 years ago. So even if you can keep your teeth for 5 or 10 more years, the replacement for that tooth, if you break it, which if you have a root canal, I'm going to tell you, your chances of breaking it go up. Think you're 200 pounds per square inch like this, and we've cleaned out the center of that tooth and thinned it out and weakened it. You know, it'll hold that tooth in your mouth for a long period of time, but it doesn't prevent it from breaking. And it's thinner than any tooth in your mouth. So the fewer teeth you get, the more pressure you put on those remaining behind. You know, so there are a lot of variables in there that you can break teeth or crack teeth or, you know, and then if you do, you have to have an implant. The other reason why I would delay implant, and this is why I would delay an implant personally, the only other reason is right now there's a lot of, you know, just like everything else, we have better imaging technology. I showed you things that I couldn't have seen when I started my career doing this 30 years ago. But right now they're doing cell culture, stem cell therapy, and my husband just had in his hip platelet-rich plasma injected into his hip to try to diminish to stave off that hip replacement because he's had early osteoarthritis for like 20 years. And his pain levels are a lot better. They're doing platelet-rich plasma in dentistry, like in little kids. That pulp I was telling you about, we didn't go into that. That pulp's needed to make the tooth grow. If you don't have the pulp, if it dies prematurely, the tooth won't grow. So you have these little bitty short stubs that are wide open. So we use platelet-rich plasma in the center of those teeth, and that stimulates and provides some of the components that the body needs to allow that root to continue growing. You know, so there's more science going on to replace teeth. I think the implant of the future will be a few stem cells that they take out of your blood and jam into the socket, add a little mesh that has the right growth factors, and you'll grow a new tooth.
Oh, that would be amazing.
I mean, and they're working on all that right now, I mean, scientifically. So,
Awesome.
sure, Jean.
If a person has to take a multitude of medications, what do you suggest to remove the bacteria?
You just, good oral hygiene is all you can suggest. And understand that because you're on medications, if they are the kind that will lower your saliva flow, not all are, you know, you'll know if they are because you get dry mouth.
Oh, yes.
You know, and if you, if you are one of those, they make products like Biotene that you can rinse your mouth with, but just regular rinsing your mouth with water will help keep it moist. You know, so I don't know, there's not a whole lot you can't change and get your saliva flow back. And you just have to do whatever you can to assist your body. Keep it,
This one's had cancer for the 3rd time. Plus, he's lost all his upper teeth. He only has 7 left on the bottom. Now, when he had his cancers, the first thing he was ever asked was, did he smoke? They said it softens teeth. It causes all kinds of problems. Do you agree with that?
I don't believe it softens the teeth. So I would be in disagreement with that statement. Does it change your environment in a way that the bacteria can cause more damage on your teeth? It does. You know, but it does change your vasculature, and you can't heal as well when your vasculature is changed.
Oh, he heals beautifully, and so do I, and I'm diabetic.
You could have healed better if you're not a smoker or not diabetic. I'm just telling you, I mean, it's just, I'm glad it is. Everything in medicine is. You know, it's always a risk and a benefit. You're always looking at each unique person, you know, and what to do. Unfortunately, different kinds of chemotherapy drugs, great at improving bone density. You know, the problem with bone density drugs is it's incorporated in every single bone in your body. So if you take bisphosphonates, and they were cancer drugs, and they learned that people got denser bones who were taking these cancer drugs, you know, and so they started marketing the cancer drug, one of the combination of, because it's usually a cocktail when you're on cancer therapy, but so they give those to us now in oral pills when we're osteopenic. But those pills are impregnated into your body, and they make your bones denser, which is fantastic. But if you extract a tooth, it breaks and you have to take it out. Your bone is now incorporated with this drug, and when that drug and oral bacteria come in contact with each other, sometimes it causes what we call osteonecrosis or dead bone syndrome. You know, so the bone will die, and there's not a drug you can take to fix that. You know, so there's always a balance. People are like, I told my mother-in-law not to take the drugs when she was first diagnosed with osteoporosis, because I was worried about the oral implications. And what happened, you watched Shirley, a lot of you knew Shirley. You know, she went from this to this. And now she, you know, her spine just started breaking down because of the osteoporosis. So I blame myself for a long time that, you know, I influenced her not to help herself early on with those medications, because I was worried about one aspect of the problem. And so if your physician says you need drugs, you know, then you should take the drugs, like for whatever your condition is. But you have to realize that drug is going to impact other things, and you may not be able to take your teeth out later. You know, so I have a lot of patients now that I do root canals on teeth that normally we would extract because they're really bad. But I work with oncologists, and if you get the bacteria under control, the body will slowly exfoliate the tooth itself, so they have root canals, you know, in their mouth because they can't have their teeth out, you know, and then the bone replaces itself, you know, as it comes out. So it's a balance. You know, I have a lot of cancer patients who have to have root canals because they're on these drugs and they can't take their teeth out. And now their saliva flow is low, and they get cavities and break off and do other things. So you just work with a multitude of professionals, and hopefully you have good medical benefit and some benefit that helps you defray the cost of that, you know, if we live long enough.
Never had dental insurance, and it's killing us.
No, dental insurance, you know, again, I don't mean to be on my soapbox about dental insurance. We'll talk about it, but basically that's a prepaid program. You know, it's wonderful if you work for somebody and they provide it for you, because you're going to get some benefit you couldn't have. But you take, for instance, a $1,200 policy, like I have to pay for my family, you know, because as a small business, you can't get big group insurance programs. You pay $1,200 a year, and for 30 years that I've been in dentistry, the maximum benefit you get out of that is $1,000 or $2,000. So it's, even if you have dental insurance, They'll cover some things like a cleaning and some x-rays and a minor filling, but you have to pay that policy, like for a root canal in ours, you have to pay the policy for 2 years before they'll even cover 60% of your root canal. They don't cover it all. Or 50% of your crown. I have not seen a policy that covers more than 50% of a crown in 30 years. You know, so yeah, dental insurance is great if somebody's providing it for you, and it's better than nothing. But don't beat yourself up. Take your $100, put it in a bank account, mark it dental, and then every year if you have dentistry and you need a grade, if you don't, you've got it till next year. That's my husband coming out. Again, I want to point out my beautiful preemie over there.
I have a question. Is there any value in the fluoride treatments that my dentist pushes every 6 months, where they paint on the fluoride? Do you recommend it?
I do. When you ask, do you recommend it? It's based on what the science is that's out there. They have just freshly cleaned all the junk off your teeth. And if there's any time where there aren't proteins or other things sticking to the outside of your teeth, the maximum time to get any benefit from any fluoride is at that point. You know, so any surface fluoride is only going to improve the strength of the external part of the tooth. So do I believe in it? Yeah. Does it hurt you? To my knowledge, there's nothing bad about it other than the cost. You know, the pocketbook hurts, but...
Instead of that, can you do the mouthwash?
The mouthwash, that is more concentrated than the mouthwash. And also with the mouthwash, you have biofilms. You know, we eat something, it's sort of sticky, the saliva is sort of sticky, and you have this sort of gelatinous sort of covering on your tooth. You put a mouthwash, it covers some of the gelatinous covering. When your teeth are cleaned, that's gone. You know.
Paint it on and it stays for
well, until it washes off or you wash it out, but I'm just saying your teeth that they're putting it on are as clean as they physically can be.
like sanding before you clean it.
Correct.
George, did you find that it left?
No, they tell you to eat for a couple hours. It's really disgusting.
It tastes fine. I know I have it. There are different ways to put it. That's one way. You can use a tray. There are a variety of ways to get it on. But in general, putting fluoride on after a cleaning is helpful to your teeth and the best time that fluoride will impact your teeth in a positive way. And okay?
Just one quick one. You said about the sodas drinking the acid in your teeth.
Uh-huh.
I'm a big coffee drinker. Is that affecting my teeth?
It depends on what you put in your coffee. No.
Ultra hot, though. How about ultra hot coffee?
Oh, it doesn't matter. You can't hurt yourself with hot. Your body won't let you put anything too hot. Your body will only allow what's maximally tolerable. You can't damage your teeth by extra hot. You can't damage your teeth by black coffee. But you can damage your teeth with a latte every day or especially if you like lavender flavor or something in it. Okay. Well, thank you all very much.